I'm Chris Hansen. I'm the president of ACS CAN, and I am speaking to you the morning after the State of the Union address. And I just wanted to make a few observations about that address last night. The president did what you would expect a president to do in a State of the Union address. He talked about the state of the country. He talked about the state of our economy. He talked about the state of our foreign affairs and our national security. Also offered his view on what he views as a middle-class economy and some of the things that he feels that we need to be doing around the world. There were things in this speech, however, that were very, very important to us. He didn't focus as much on healthcare as he has in previous States of the Union, but he said a couple of things that were actually very significant to us. The first one is he talked about a precision medicine initiative, and that was very much in the context of funding for the National Institutes of Health and for innovation in private industry to continue to develop the things that come out of the National Institutes of Health, and particularly the National Cancer Institute. Frankly, when he specifically called out cancer and diabetes when he talked about it, we don't have all the details on exactly what that initiative is going to do or how much money is going to be attached to it just yet. But we are very optimistic about what we think it means, because we know that genomic medicine is a huge opportunity for us in the fight against cancer. Personalized medicine and funding that innovation is something that it presents enormous opportunity for us. We've always known that our biggest target this year is to try to continue to focus on federal funding for cancer research. We are going to be starting an initiative in March to really start accelerating that work, partly because the budget caps that we've been living with for the past several years, which have prevented people from being able to raise the ceiling of funding for the National Institutes of Health or the National Cancer Institute, those budget caps expire on the last day of September. So this is the right time for us to really gear up to make the case for more substantial funding in this area. And I think that this initiative is a huge opportunity for us in that respect, and you're going to be hearing more from us about it. Let me also mention one other thing, and that is that there was another thing that the president talked about when he talked about trade agreements. This is something where there's a fair amount of agreement actually between the administration and Republicans in Congress. And there is an opportunity for us in this, because these trade agreements that the president was talking about will have an exemption in them which will make it virtually impossible for tobacco companies to use the investment portion of those trade agreements to continue to challenge other countries' health laws and regulations, as they've done so successfully in recent years. And considering the fact that tobacco is going to cause 1 billion deaths in this coming century if we don't do something about it, this is a huge opportunity for us as an organization to support something at the national level that will allow us to save millions of lives around the world. And again, this is something that we're going to tell you more about going forward, and I think there'll be opportunities for us to help. And we'll tell you when the time is right and see whether or not it's something that you'd like to be involved in. But let me say this also. We are going to have a lot of opportunities this year. We're going to have a lot of challenges as well. But we're going to have a lot of opportunities, and we're going to have a lot of times that we're going to need you to be involved, and we want to tell you about the things that are going on going forward. You've been wonderful. You are the power in this organization, and we are going to continue to move forward, and we know that we can. And that's because of all the good work that you do. And thank you so much, and thank you for listening to me today.